Hello, welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at Sherwood, and today I've got with me Sally Palmer, Nurse Consultant, Infection Prevention and Control, James Thomas, Clinical Chair for Diagnostics and Outpatients, more of that later, Amy Gouldstone, our People Wellbeing Lead, and Sam Caudwell, our Hospital Independent Domestic Violence Advisor. And as always, in the background, there's Jess Baxter from our comms team doing all the technical background and keeping us all safe on today's brief. So today we'll be covering off a few topics. Sally will be giving some updates around the changes we've already made to face mask guidance. James will discuss changes to the Diagnostics and Outpatients division, and Amy and Sam will discuss domestic violence. And before I introduce Sally, first up, some general updates from me. So firstly, I'm sure that we're all aware that the Men's Football World Cup is currently taking place, and of course we will be celebrating and supporting our chosen teams possibly tonight, and joining patients and colleagues across the trust showing support over the next 2 to 3 weeks. Please remember, please do not stream matches on any work device or network, and that's to ensure that our core networks run smoothly for clinical work. It's quite a heavy stream last Monday for the England match, so please do not use staff devices or networks to stream. Patients can use the free public Wi-Fi. That's the NHS Wi-Fi option if they want to stream matches on their own personal devices, and please give them assistance if that's their wish. Okay, next up, Newark Hospital briefing. The next Newark briefing will be today at 3:30, last about an hour, so 3:30 until 4:30 today. David Ainsworth, the Director of Strategy and Partnerships, will be leading it along with Rob Simcox, Director of People. Everyone is welcome to attend. You don't need to be based at Newark Hospital, and in fact we want as many of you to get involved in making Newark Hospital a valued and vibrant community asset. The focus of today's session will be on estates, and Ben Widdowson, Head of Estates and Facilities, will provide an update on various projects, including a planned extension to car parking at the hospital site. Particularly welcome colleagues based on any site. As I said, you don't need to work on the hospital site at Newark to join, particularly people who would benefit from finding out more about services that are available at Newark, so we can encourage patients to choose Newark or ask for Newark at the point of contact. The meeting is held on site in the boardroom at Newark Hospital. Alternatively, you can join on Teams, and Jess, I'm hoping, will be just posting a link to that meeting in the chat as we speak. Lastly from me, I don't need to mention National Staff Survey this week. That closed last Friday, but I'm continuing to mention flu and COVID vaccinations, continuing to encourage colleagues to receive both of these vaccinations. Thanks to all colleagues who've had vaccinations so far. We know that over 56% of frontline colleagues have had their flu jabs, but we know we can do better. We've done better in the past. The Diagnostic and Outpatient division has the highest uptake so far with 55%. So well done, James and team, and keep that going. The next planned flu clinic is tomorrow here at Kingsmill in the King's Treatment Centre, and that's between 12:30 and 3:30. You can obtain vaccinations from peer vaccinators who are on most wards on all sites, and they can provide a flu vaccine for you. You can also book appointments for either the flu or the COVID vaccination online. Again, Jess will be posting the link in the chat. And there are various pop-up clinics being held, and we'll share the details of these as and when we get them through, and we'll share them in the bulletin, on the intranet page, and also on the Facebook. Don't forget, if you do have a flu jab, you'll also be given a free meal voucher to be used in the Spice of Life restaurant, and also be entered into the monthly prize draw. Flu's on the increase, so please consider getting your vaccination. It's important to protect yourself and your team and our patients. Okay, so don't forget to use the Q&A, the chat function, if you've got any questions. And with that, I'll hand over to Sally Palmer to give us some updates around the changes to IPC guidance, specifically around our use of face masks. So welcome, Sally.
Thank you, Paul. Afternoon, everybody. So yes, hopefully you've all seen the communications that have gone out over the last few days with regards to us changing our face mask guidance. So what we've currently done is we have reduced the use of masks in non-clinical areas. So if people choose to still wear them in non-clinical areas, that's okay, and you know, that won't be looked at poorly on people. It's up to you, it is your choice. But if you choose not to wear them in non-clinical areas, then that's okay too. We aren't mandating it at the moment. We will be continuing to review that on a regular basis and keeping an eye on our COVID and flu numbers within the organisation. And we do have some set trigger points where we can step down and step up if we need to make sure that our patients and staff are kept safe at all times with regards to that. So if you are in an area that's non-clinical, then you won't be expected to wear a mask at this point. We are still seeing COVID positive patients come through our front doors, and we are starting to see an increase in our flu cases and RSV cases as well. So all respiratory viruses are prevalent at the moment. We do currently have more flu patients than COVID patients in the organisation. So as Paul was saying, it's still really important to get those vaccinations if you've not had them yet. We do encourage that. If there's any queries or concerns over mask wearing, if you're unsure, please do get in touch with the infection control team. We'll be happy to discuss and to work through any problems or concerns that you may have.
Thanks, Sally. So I've got a couple of questions, if I may, and there's one that's already come through, and we'll come back to that. So you mentioned if people want to continue wearing face coverings in non-clinical areas, if that's what makes people feel comfortable. So will masks still be available at the access points to the building that they have been available, well, for 2.5 years now?
Yes, we're not removing any of the mask stations at this point. We're leaving them all in place because our visitors and patients are still required to wear them as they're going into clinical areas, but we're still leaving them at the staff entrances as well. So staff can still get access to masks as they have been available throughout the last 2.5 years.
Great, thank you. And you mentioned trigger points, so we keep it under scrutiny. I guess that's weekly. And I also, I think I'm right in saying that it's not just the COVID numbers; it's all respiratory diseases, including flu and RSV, that we'll be keeping under a close scrutiny. Yes,
that's it. We're looking at them all. They all, require the same precautions from us, so it's important to include them and be looking at it as a whole now, not just of COVID as respiratory virus in general. So we will be including all of them.
And that's on a weekly basis, is it?
It is, yes.
And we have a daily situation report that which notes us the numbers of patients that we have well positive in each of those viruses.
Yes. So originally it was just a daily COVID sit rep, but now we have expanded that out to include flu and RSV within that as well. So we can see where the patients are as well. They're all tagged on Nerve Centre for patients that are positive or post flu, post COVID, do all have an individual tag as well on Nerve Centre, so that can be seen at a glance as well.
Brilliant, thank you. So there's a couple of questions, and I guess the questions are linked to distancing and our protocols around that. So the first one was, will room occupancies be reviewed in non-clinical areas? And then a linked one was the social distancing in staff coffee rooms in clinical areas.
Yes, so we have said at this time in our non-clinical areas, we will go back to pre-COVID social distancing. So those room occupancies can be reviewed and changed now in our non-clinical areas. With regards to clinical areas at this point, we'll review that on an individual basis, but because we're still seeing those patients with COVID and flu, the risks are slightly higher in our clinical areas. So we will be maintaining the 1 metre in those areas at the moment, but in our non-clinical it's gone back to pre-COVID social distancing.
Okay, thank you. That's clear. That's the two questions that we got so far. If anyone thinks of another question on this topic, then please let us have it. Put Sally to the test if you need to. Can't see anything coming through. So thanks, Sally, for now. And I'll move to you, James. So James, you're the clinical chair in what is currently called Diagnostics and Outpatients Division. So I'll hand over to you.
Right, thanks, Paul. Thanks for inviting me on, and hi, everybody. I've been working here now for about 6 months, and I've massively enjoyed getting to know all the teams and seeing the outstanding work that they're doing. In our division, every patient that comes into the hospital has some contact with us, be it through patient notes or blood tests, x-ray, therapy. There are dozens more that I could list and be here for the full hour. And I'm personally so proud to chair a division that has got such an enormous diversity of skills and specialisms. And I know I speak for Ronki and Lindsay in this too. It's really important to us that each and every member of our division genuinely feels that their fantastic contribution to the care of our patients is recognised and appreciated. And so with that in mind, we realised that there may be something we could do better around our name and choose a name that perhaps more fully captured all of our departments so that everybody felt that they belong. It hasn't been easy. There are lots of specialisms and lots of various options. We've had lots of conversations with people about various versions of a potential name. And we've chosen Clinical Support Therapies and Outpatients, or CSTO for short, as our new name, which we feel captures the diversity as best we can. We're going to use CSTO as a short version, and you'll find our new Twitter account at SFH_CSTO. We've got a new management email address as well, which those in the division will already be aware of. The change happens officially on Monday next week. There are posters going up around the hospital. They'll be in our departments as well. There's a divisional newsletter which is going to be dropping next week. And we've got a few more plans as well about how to increase the visibility and availability of the divisional team, which staff in the division will already know about.
Thanks, James. I think you said this word for word, but it's really important to recognise and appreciate the whole breadth of services that's within the division, and clearly diagnostics and outpatients doesn't even touch the sides there, does it? So I can see the real importance of considering alternative names, and I know that you've consulted widely across the division. So let me get this right: clinical support, therapies and outpatients.
That's right, yes, CSTO.
Yeah. CSTO trips off the tongue a little bit more smoothly, doesn't it? And that's from Monday, the 5th of December.
On Monday the 5th, it'll take a little while, obviously, for that change to work its way through all of the various spreadsheets and lists and things that we have in the hospital related to HR and payroll and staff survey, but we'll get there. But from Monday the 5th, officially we are CSTO.
So you're celebrating on Monday, having a cake or something, CSTO cake.
That's a really good idea. I'm gonna get the team onto that.
Yeah, yeah.
Unless you're offering to bake it, Paul.
I would, but I'm not around on Monday. I'm sorry, James. I'll miss the party. Okay. You wouldn't want a stale cake, would you? Great. So that's great that we can that you come into post in 6 months, seeing that recognition needs to be broader and wider, and really making an impact. So thank you for that. Thank you to your divisional leadership team as well for the work you've all put into this, and the consideration and that you've made for the whole team, really. So thank you very much, and we look forward to seeing CSTO. But as you say, things take a little bit of time to tick through in terms of getting all systems up and change, but we'll get there.
Thank you. Yes, and in the meantime, we'll be flooding the hospital with posters. You won't be able to escape the name for a few weeks at the very least.
I look forward to that, and seeing tweets of the cake as well on Monday. So I look forward to that as well. Great. Okay. Thank you. So no questions on that. Hopefully that's going to be really well received across the division, really well understood across the rest of the trust. So thanks for giving us that update, James. Okay, Amy and Sam, we were discussing just as we were sort of warming up before we went live, that domestic violence is really important to be raised as an issue during a World Cup. So I mentioned the World Cup earlier, and that's exactly one of the things that you're going to pick up. So I'll hand over to you, Amy and Sam.
Thanks, Paul. So hello everyone. If you've not met me before, my name is Amy Gouldstone. I'm the People Wellbeing Lead, and I'll pass over to Sam to introduce herself, and then it'll come back to me. We'll present this between us.
Thank you, Amy. Yeah, so my name is Sam Caudwell and I'm the Hospital Domestic Violence Advisor. I work for Nottinghamshire Women's Aid and I've got around 13 years experience in the domestic abuse sector, but I'm actually based in the safeguarding team at Kingsmill Hospital. Now, my role is there for patients as well as members of staff. So any patient that presents at any of the sites and discloses domestic abuse, or where staff have concerns that there may be domestic abuse happening to that patient, I can offer advice and support to the member of staff or directly to the patient, whether that's face-to-face or via the telephone. The other route of support that I offer is to members of staff who experience domestic abuse in their own relationships. And we are going to look at some statistics shortly, which will show you how sort of relevant that is to our trust. Back to you, Amy. Thank you.
Thanks, Sam. So I'm just going to share some slides. As Paul says, we're here particularly because of the connection with the World Cup, but it was also White Ribbon Day on the 25th of November, which is the start of the 16 days of activism against domestic violence against women and children, women and girls in particular, although we very much recognise that domestic abuse can affect anybody, and no matter what your gender or gender identity, and it's particularly high in our LGBT community as well. So because this is quite a triggering topic, I just wanted to straight away put out there that there is support out there. There's so the top number on there is our VIVUP Employee Assistance Programme, and they have some connections in with domestic violence and domestic abuse support. So that's a good one. If you don't take any note of any number, you can ring them on either of those numbers. It actually goes through to the same phone, same team. So if you've already got them saved, sorted out, but also put the mental health crisis access line on there, because we are going to mention the word suicide today as well. Again, it can be really triggering. And then one of the things that's was really fascinating to me was how many domestic abuse support phone lines, websites, things there are. There are absolutely loads. There's some that are local, some that are national, and it can be a bit overwhelming. So Sam and I discussed that if all else fails, the National Domestic Abuse Helpline can signpost you into the relevant ones, but also kind of get your support as needed there and then as well. So that's the one we've kind of put up on here. So a few to pop on in your phone if you haven't got them already. I'll just post them in the chat so it's there when we click off this slide, if that's okay. So I'm going to click across. She'll pass back to Sam.
Thank you, Amy. So what is domestic abuse? You will note a language change here that we're not calling it domestic violence. And that's because domestic abuse doesn't just incorporate physical and sexual violence. We have the underlying subtle behaviours that aren't necessarily visible. So what is on the screen is the current government definition of what domestic abuse is. And I just want to highlight a couple of key points within that definition. So it recognises that domestic abuse can be experienced by those aged 16 or over. So we're not just looking at adults experiencing this, we're looking at our young people too. It is happening to even younger than 16, but at present the government recognise that it's 16s and over. I also want to highlight who can perpetrate domestic abuse. There is a myth that it only happens in intimate relationships by partners, but this is untrue. Domestic abuse can be perpetrated by family members as well, regardless of gender or sexuality. The definition then breaks down the different types of abusive behaviours. So we have the psychological, the physical, sexual, financial and emotional. And as of 2015, we saw coercive control become a criminal offence. So we are recognising that coercive behaviour is very prevalent in domestic abuse relationships, and this isn't something that you would easily spot. So throughout our small session today, we are going to help you and equip you with the tools to be able to recognise and to advise you on what to do if you do recognise that. Next slide, Amy, thank you. So how many people are affected by domestic abuse? So we are going to break down some national and local data. So if we look nationally, this on the left hand side, it says that 1 in 4 women will experience domestic abuse in their lifetime. And we linked in with HR and looked at how many employees we have at the trust. Now, 1 in 4 women would actually equate to 1,591 of our female members of staff experiencing abuse. Likewise, it says that 1 in 6 and 7 men experience domestic abuse, and this would equate over to 332 male staff members. Nationally, in England and Wales, in the year 2020 to 21, there was a reported 1.4 million people experiencing domestic violence and abuse, and that was an increase of nearly 80,000 on the year before. Locally, to narrow it down, so I'm talking about Nottinghamshire County and City, in the year 2020 to 21, there was 20,464 known cases of domestic abuse, and Nottinghamshire has the highest rates in the East Midlands.
Thanks, I'm sorry I slipped over quite quickly on that bit, but yeah, really quite stark statistics, and hence the reason I'm here as well, people wellbeing lead as well. So thanks, Sam, on that. Some other statistics, I said we mentioned suicide. So one of the things, we have domestic homicide as a result of domestic violence, and unfortunately 2 to 4 women a week die due to domestic violence or abuse. And that went up to 5 a week in lockdown. But in addition to that, 3 women die by suicide because they feel like it's the only way out. We don't actually have the statistics on men, and some of that could be a bit of underreporting, but that they are a little smaller. So locally, just Nottinghamshire, to give you an idea, that was 18 domestic homicides, so 18 murders as a result of domestic violence. So and Notts Police gave us some figures that about a third of violence against a person that's reported is domestic abuse. So it's really high. It is really high. So if you weren't convinced before, hopefully these statistics give you an idea of why we're so passionate about this and why we're so lucky to have Sam in our organisation. I've popped on there again the mental health crisis access line, just again if this is a bit triggering for anybody. And back to you, Sam.
Thank you. So just further on statistics, we are a lot about numbers, but we really need to show how important it is that we recognise, we break down the barriers and we get that support in place. So research states that 70% of high-risk victims have children. Now, the trust safeguarding, we have a think family approach. So it's not just about that person presenting or disclosing that domestic abuse. It's about us thinking as professionals, who else in that household may need safeguarding. So we're thinking holistically, are there vulnerable adults in that household? Are there children? And as that statistic shows, 70% there are children, and they need our input as well to help safeguard them. It takes on average 50 assaults before a victim reports to the police. Now, these assaults can vary from a push or a shove to more significant assaults which require hospitalisation, but on average 50 before they're reporting. Research from Gallup, which is the LGBT anti-abuse charity, they say that 75 to 90% of domestic abuse experienced by LGBT plus people goes unreported. But what we do know is that physical violence is more prevalent in LGBT relationships. And a further statistic, it can take on average 7 attempts to leave an abusive relationship before you leave for good. So I know this all sounds very doom and gloom, but there is light at the end of the tunnel. And more local information is that in the last 12 months up to today, out of 2,205 survivors that were supported by Nottinghamshire Women's Aid, which covers the north of the county, 67% did not reconcile with the perpetrator. So this goes to show that people do survive domestic abuse, and with the right, appropriate specialist domestic abuse support, we can help you to end that cycle. So the White Ribbon Campaign and the 16 Days of Activism. The White Ribbon Campaign has been around every year since 1991. It is a global male movement working towards ending violence against women and girls. And this year, as we've noted, it fell on the same week as the start of the FIFA Men's World Cup. So the theme this year is #TheGoal. And the theme will highlight 11 traits that men and boys can nurture to help create equality and safety for women and girls. You will see those 11 traits on the image on the screen on the backs of the football shirts. So the link between domestic abuse and football is that we actually see an increase of 26% when England play and a further 38% when England lose. Now, football is not the cause of domestic abuse, absolutely not. But it is another excuse that perpetrators use to minimise their abusive behaviour. So what you will see on the image is a QR code. And this QR code will take you to the White Ribbon Campaign website, and it asks you to make the pledge to promise never to use, excuse or remain silent about violence against women and girls. We hope that men especially will make that white ribbon promise, but everyone is welcome to make it. So please follow that link and pledge your support to end violence against women and girls and create that equality and safety for all. Over to you, Amy. Thank you.
Thanks, Sam. I'm hoping this is a bit of Sam mentioned regards being able to help someone, because people do survive abuse, but sometimes it doesn't go mentioned, the number, and this could be from a patient perspective or a staff perspective where someone has suspected something but they felt uncomfortable about asking, worried that they might put someone at higher risk, hence why we're kind of sharing this. So again, National Domestic Abuse Helpline is popped up on there, and there are 2 local phone numbers there as well, one for women and one for men, that we use. But I was just going to show a 1-minute clip that just, it sums up better than either Sam or I could quickly enough as to what to do with if you spot the signs, and reaching out to #HelpAFriend, which is the campaign that Equation have done. It's okay. So just to make you aware, this does not have any sound, so it's not me being rubbish with technology. It doesn't have any sound on purpose. So I'll just play this 1-minute clip. So I hope you were able to see that. I'm conscious that might have been a bit small. So you will see in the bulletin that video has been posted, so you can see that again if you wanted to rewatch it. I think it's quite powerful that it has no sound, because it makes you really focus on actually what it's saying. But some of the speech bubbles really resonated with me, things that I've heard people say before. I feel like I'm sticking my nose in, and they were going to go anyway. So there is support out there. Of course, goes without saying, 999 if anyone is in immediate danger at all. So I shall leave that one there. Sorry, it's going to start playing again. Here we go. So the other thing, because this is quite overwhelming, and I certainly found it overwhelming way back when, before I knew anything about domestic abuse, is we do have some free domestic abuse training, which gives you a bit of awareness. So if you're in a clinical role, you might already have some domestic abuse training, and you might find that this is a bit of a repeat. However, there's some specific topics that you might find really interesting. So I'll post a link in a second to the list of different topics that you can book onto related to domestic abuse. But this training was put on particularly in mind that managers, colleagues that might spot domestic abuse in a friend, colleague, or family member might not get that training, might not get that in-depth training. So this is available for you. So some of the sessions are around 3.5 hours long. They are quite big, but it's intentional to kind of make it hopefully you come away a lot more confident. I certainly did when I attended my refresher in this a couple of months ago now. So let you know about that. Like I say, I'll pop the link to that in there. So if you do have any questions that you don't want to ask, obviously in the chat, feel free to post them in the chat if you've got any. But Sam can be contacted through the safeguarding team on extension 3357, or wellbeing team, myself and Corinne, my colleague, can be got on 3512, or sometimes easier to get us through the wellbeing email address as well, which anyone that's seen me talk before talks about the wellbeing box every time. But do feel free to pop us questions through there. We're not necessarily crisis services, which is why we posted all those other phone numbers, but if you've got any questions about the content that we've talked about today, please do get in touch, and I'll stop sharing. Thank you for listening.
Thanks Amy and Sam for that, really powerful. I was shocked by the statistics. So the issue, you know, we've talked about before on the staff briefs, but I can't remember seeing quite the shocking statistics that you brought today, both in terms of the volume, the prevalence, but also the misreport or the unreporting, or the how many incidents take place before a report is filed. It's so important that we support people experiencing this. And there was a question, I think you probably answered it, but it might be worth reiterating. So I'm sort of being concerned, as we've been listening, that, you know, people might this might trigger something with people. So how can they get that signpost? How can they signpost it to help? So you've posted some numbers in the chat, and there's the National Domestic Abuse Helpline as well. Is there anything else that people can and should do?
I was going to say first, the domestic abuse helpline is not there just for those that are experiencing it. Of course, it's there for anyone that's concerned about someone that's experienced it. So I'd just say pick up the phone and have a conversation. I think it's like any stigma reduction that we need to do, that we need to talk about it more. Training, of course, can help, but yeah, I think it's don't be afraid to pick up the phone and ask is the main message. And particularly around men in reporting domestic abuse, I think Ali, our EDI leader, has done some really good stuff around allyship and sort of really speaking out. So I think it's kind of really working with that, and actually we need our men to kind of shout up for women, but men can experience domestic abuse as well, like we said, not just those in same-sex relationships, but in others as well. So I think it is about talking about it and letting people know that there's a lot of support out there, and obviously feel free to have a conversation with us if that's easier than going to a national helpline. I don't want to put pressure on Sam, but Sam, please shout up if I've missed anything there.
So if you didn't want to speak to any via a helpline, there are the websites. So Juno, Nottinghamshire Women's Aid and Equation, they have lots of information and signposting and referrals. They also have a function where they have a hide me button. So if you are experiencing domestic abuse and you are looking on these websites and you need to come off it quickly, if you press the hide me function, it deletes it from your search history. So therefore it alleviates any further risk. So please reach out via online or via the telephone numbers. And in terms of breaking down the barriers, particularly amongst men, we are trying to encourage routine inquiry. So asking everybody, whether that's patient, colleague, family, friend, just asking about everybody about how safe they feel. There is a bit of a rhyme that we use, silence breeds violence. Okay, to break this down, we need to break that silence, talk about it more. It is not okay, but what is okay is for people to speak out. The help is there and you are not alone. Thank you.
Thank you, Amy and Sam, and you were in part addressing a question that we received there. So the question was, how do we break down the barriers, particularly amongst men in reporting domestic abuse? So you specifically answered part of that, and I was also thinking that there was something about the white ribbon promise that would be important here as well, so that people become aware through that white ribbon period, and also understanding the pledges there. So really take a good look at that and really make that promise, that pledge, and start to break those barriers down. Okay, thank you. So I don't think there's anything else in the chat. Sam, Amy, is there anything that you want to leave this topic with? If there's something that people need to take away from this in a couple of sound bites, what would they be?
I think Sam said this better than me around speaking out and asking. It's okay to kind of go into that uncomfortable space and ask anyone how safe they feel. We sometimes worry, that we're taking the lid off a can of worms, but actually by not asking, that could be leaving someone at risk. But I'm sure Sam might finish off with her words on the rhyme as well. I'll pass back to Sam.
Thank you. And just quickly, if you are a member of staff experiencing domestic abuse, you are not the person that is in the wrong. The trust have policies and procedures around members of staff who are living with that, and the support is there for you. You're not going to lose your job because of it. So please don't let that stop you from speaking out. The support is there. And as I said, silence breeds violence. Let's break that silence. Let's talk about it more. Thank you.
Thank you. Thanks for that. And just as you were speaking there, we got another question in. Is there any provision or information for those we support for whom English is not their first language?
That's a really good question. I'm sure the national helpline will have sort of connections with Language Line, and it might be something we need to go away and do a little bit more digging on. There are so many domestic abuse charities and organisations out there. I can't think of one off the top of my head. Sam, have you got any ideas?
Yes, so there is a Polish helpline, but within the safeguarding office, I do have many different language formats of the domestic abuse helpline red and black card. So there's various different languages. We've also got a learning disability domestic abuse card, and we are looking into what we can do in terms of Braille as well, because we need to make it accessible by all. But we do link into Big Word and Language Line where necessary.
Okay, thank you. And as Amy was sort of suggesting there, a little bit more we can do to communicate that, understand what support is available for people whose first language is not necessarily English, and communicate that. Okay, thank you. So thank you for that. We've got one question unanswered, and I think it's one for you, Sally. So now that masks are no longer needed in non-clinical areas, what are the regulations on Christmas decorations in office spaces? So important, this.
Absolutely. Yes, for us, from an IPC perspective, we are happy for Christmas decorations to go up as long as they're clean and in a good state of repair. Then we're happy. We're not going to stop anybody. The only request we do make is that nothing is stuck into the ceiling tiles or dislodges the ceiling tiles, because that affects ventilation and opens us up to other things as well if we're dislodging ceiling tiles. So that's the only request we make.
That's great, thank you, really clear. Okay, thanks everyone. There's no further questions that we need to take a look at. So thank you for joining us today. Thank you, Sally. Thanks, James. We look forward to celebrating on Monday. Thanks, Amy and Sam, for bringing such an important topic to us, and you've really shocked me with statistics. So thank you for bringing that to our attention, and certainly I hope that people can support in any way they can. And if you need that support, then really take the time to look at the helplines, to use the helplines, and if you feel more comfortable approaching Amy or Sam or or using the email, please do that. Okay, with that, I'll say thank you for joining. Thank you for those with us today. Thanks for Jess in the background with all the technical wizardry. I hope you have a good rest of the week. I hope if you're interested in football that it works out in your favour, and we'll see you again next week. See you soon.